Let's discuss neonatal abstinence syndrome. So, during pregnancy, maternal opioids, for example, methadone, buprenorphine, or heroin that is used by mother, crosses the placenta and act on the fetus, causing chronic intrauterine opioid exposure. After delivery, there is abrupt cessation of maternal opioids that causes neonatal abstinence syndrome, also known as neonatal opioid withdrawal syndrome. Neonatal abstinence syndrome typically presents within 24 hours of birth in patients exposed to short acting opioids, for example, heroin, and within 48 to 72 hours in those exposed to long acting opioids, for example, methadone. In a high clinical suspicion of neonatal abstinence syndrome, a negative fetal urine drug screening does not rule out the diagnosis because it detects maternal opioid use within only a few days of delivery. So, when there is a clinically suspicious infant with neonatal abstinence syndrome, and when we do urine drug test and it comes out to be negative, what to do next? Instead, umbilical cord blood and meconium drug screenings are performed because they can detect more long-term maternal opioid use. Now, if we talk about the clinical manifestations, those includes wakefulness, that is the short sleep cycle, irritability, tremors, hyperactivity, diarrhea, rub marks, apneas, weight loss, alkalosis, lacrimation, the vomiting, yawning, fever, jitteriness, and those kind of symptoms are usually seen, and there are many symptoms. And how to remember all those symptoms? I will give you a simple mnemonic, which is withdrawal. So W is for wakefulness, irritability, tremors, hyperactivity, diarrhea, rub marks, apneas, weight loss, alkalosis, lacrimation. Now, the infants with mild symptoms require only supportive care. That includes swaddling, small frequent feeds whenever possible, and low stimulation environment. That means we can tell mother to keep the baby close to the mother and provide a quiet, non-stimulating environment. If the infant is presenting with moderate to severe symptoms, it requires opioid replacement, and that could be with morphine, or could be methadone, or could be buprenorphine. And this is to manage the symptoms and allow them to feed and gain weight. Thank you.